Good evening and welcome to the community meeting on school reopening. Before we get started this evening, we'd like to ensure that all of our parents can access the presentation in their preferred communication language. So we will ask our interpreters to provide instructions now. Thank you.
ቤተሰቦች
Estamos siempre.
Let us start with our Spanish interpreter, please.
Buenas noches y bienvenidos a la reunión comunitaria reapertura de nuestras escuelas. Estamos interpretando simultáneamente al español. Oprima el símbolo del globo abajo en pantalla o los tres puntitos en su celular y luego escoge español. Gracias.
እንኳን ደህና መጣችሁ የኤስፒኤስ ቤተሰቦች ወደዚህ የትምህርት ቤትም ዳግም መክፈቻ የማህበረሰብ ስብሰባ ላይ የቋንቋ ለምትፈልጉ አገልግሎት መጠቀም ለምትፈልጉ በስፓኒሽኛ በአማርኛና በአረብኛ የትርጉም አገልግሎት እየተሰጠነ ያለው አማርኛን ለምትፈልጉ የዓለም ቅርጽ ወዳለበት ሄዳችሁ አምሃሪክ የሚለውን በመጫን መምረጥ ትችላላችሁ በስልካችሁ የምትጠቀሙ ደግሞ 3 ነጥቦች አሉ እሷን በመጫን የምትፈልጉትን ቋንቋ መጠቀም ትችላላችሁ thank you
And finally in Arabic.
لسماع الترجمة باللغة العربية أرجو اختيار زرار الكرة الأرضية في أسفل الشاشة ومن ثم اختيار اللغة العربية شكرا
Thank you to our interpreters this evening, Dr. Hutchings.
And thank you, Ms. Toucan. First, I just want to thank all of our families and community members who are joining us this evening. I am Dr. Hutchings, the Superintendent of Schools for Alexandria City Public Schools. And tonight we are going to be providing some updates around our transition planning to reopen our school buildings and how we're planning to transition our students back into some in-person learning over the next couple of months. And before we get started, I just want to thank each and every one of you for taking time out of your busy schedules this evening to engage with us. Tonight, we're hoping to share with you some of the health metrics that we utilize and use to determine our in-person learning and when to transition into our in-person learning. We're also planning to provide you with an overview of some of the data that we received from our staff intent to return forms. And we're going to provide you with some information pertaining to that. And then we also want to talk about the hybrid learning models that we're planning to implement when we return to in-person learning. So how our students are going to receive their instruction and be engaged in teaching and learning when we return to our in-person learning. And then finally, we want to talk a little bit about some of the health and safety measures that we're taking in regards to our facilities to ensure that our students and our staff are safe when we are able to return back to in-person. Before I turn things over to our health director, there's a couple of things I just want to point out to you all today. We hope that you will use your chat section to put in questions so that we can be sure to answer the questions. We're planning to answer as many questions as we can during the time frame that we have allotted for Q&A. And so please utilize that. And then I also just want to reference a couple of resources that we have for you and for anyone in our community, as well as our staff members pertaining to our transitional planning. One, we do have a website, our ACPS at Home website. We have a section that is specifically for our reopening of our schools. And you can find information from all of the transitional meetings that we conduct each week. You can find the presentations as well as recordings from those sessions for people who would like to see more details around some of the things that we're grappling with on our end to open our schools. And then you can also review updates that we provide in our ACPS Express that go out into our community each week. And we are highlighting different aspects of our reopening. So we hope that you are reviewing those. And if you have the time, you can also engage or actually watch our school board meetings that are conducted every other week, where we're providing updates to our school board. We will be providing updates this Thursday in regards to some more information about our intent to return forms from our staff, as well as our teaching models and things of that nature. This Thursday will be shared with the board. But I wanted to put that information out there first, just to know that there are some resources that you have access to get some more information. So today we're going to get right into our presentation. I'm going to start with going over, the 3 metrics initially that we use to determine the health and safety metrics in regards to our in-person instruction. And then I'm going to turn things over to Dr. Herring to talk to them specifically with each and every one of you. But those 3 metrics, the first 2, they deal with our community transmission, which is so important. Metric 1 is dealing with the number of new cases that we have within the city of Alexandria per 100,000 persons within the last 14 days. Our metric 2 specifically deals with the percentage of positives or COVID-19 positives in the city of Alexandria, also referred to as our positivity rate over the last 14 days. And then the third metric specifically deals with the internal or in-school mitigation measures that we have in place. So for example, the personal protective equipment, also known as PPE, the fact that we are doing cleanings and we have routine cleanings. We have refined our cleaning measures, to ensure that we're providing a healthy and safety environment, as well as the contact tracing that we work collaboratively with the Department of Health in Alexandria. So Dr. Herring is going to give more details about this, and then we're going to go right into the other aspects so we can get into some questions. So Dr. Herring.
Yes, can you hear me?
Yes, I can.
Oh, good. Thanks for having me here. Dr. Stephen Herring, Director of Alexandria Health Department. I appreciate all the work that ACPS leadership has been doing over these many months. Appreciate everything that families have been doing, that the parents are doing, and the students are doing. I'm going to go over these first 2 metrics briefly. That first metric, the number of new cases within a community per 100,000. The CDC gives 5 different levels, and I'm going to call them levels 1 through 5, where 1 being the lowest risk of transmission within a school environment, and 5 would be the highest risk of transmission. The metric for the highest risk would be 200 or more per 100,000 in the last 14 days. Well, the city of Alexandria, we're actually at 434. We're over 400. So we're more than double what it takes to be actually in the highest risk category for metric number 1. For metric number 2, we're at a level of we're at 6.3%, and that puts us at a level 3 at a moderate risk of transmission. And to give you an idea, if you're over 5% and less than 8%, you're at that level of 3. And then the metric 3, it's not reported on the website, but I can report to the community that from everything I'm seeing that the schools have been doing in terms of planning for the correct and consistent use of masks, for the social distancing, using the 6 feet criteria of if you're within 6 feet, you're a close contact. If you're within 6 feet for more than 15 minutes, they're being really good about that 6 foot of distancing. There are preparations for instructing about hand hygiene and respiratory etiquette. Their plans and what they've been doing about cleaning and disinfecting, and then their collaborations with the local health department. I can say all of those mitigation strategies, if we've rated that on that 1 through 5 level, I would say this is the one that is at a 1, that is at the lowest risk of transmission, because the schools have really taken things very seriously about all these mitigation strategies. The metric 3 is what is in the control of the schools. The other metrics, the metric 1 and metric 2, that's really in control of society as a whole, not just Alexandria, but the region and the nation and the world. With that, I think the one other thing I want to say in terms of the implementation, part of the collaboration, it's not just contact tracing and collaboration, it's collaboration in general. And one of the things that they've been emphasizing that I want to emphasize up front, that it's very important that when staff or when students are ill, and if it's any symptom, even one single symptom of COVID-19, it has to be presumed to be COVID-19 until proven otherwise. And that's one of the things that's going to help reduce the transmission within the school, along with these other mitigation strategies. So with that, that's all I have to present right now, but I'll be on this meeting throughout. So thank you, Dr. Hutchings and team.
Thank you. And now we're going to hear from Dr. Alicia Hart, who is our Acting Executive Director of Facilities and Operations, to talk about some of the safety measures that we're taking to prepare for our staff and students to return to in-person.
Thank you, Dr. Hutchings. I'm sure that a number of you have seen some of the graphics that we're going to show, but wanting to show them again tonight just as a reiteration of some of the safety measures that we are taking within our facilities. The first does include just making sure that our student desk and our teacher furniture as well is properly socially distanced within each classroom, adhering to the 6-foot social distancing guidance. You'll also see the use of sneeze guards on student desks as an extra added precautionary measure within our classrooms. Next slide, please. Throughout our facilities, we are also installing social distancing markers and signage as a reminder when we return to school for our students, for our staff, to make sure that they are mindful of maintaining social distance throughout the day. This is an example of a marker on the floor, but again, we are using these on the floor, on the walls, and in other areas to just really reinforce the importance of social distancing within the building. Next slide, please. This is another example of hallway social distancing measures that includes floor signage, arrows to point the direction in which students should travel, as well as cones that help to mark the appropriate social distance. Every hallway in every school is going to be slightly different, so the setup may not necessarily look just like this, but again, the importance is making sure that we do have various markers and signage to help reinforce social distancing in our facilities. Additional measures, and I've seen a few questions already in the chat regarding HVAC and our ventilation. We have since March continued with our preventative maintenance of our HVAC systems. That does include making sure that our systems are functioning properly and changing filters as well. As we continue on with our preventative maintenance, if there is a problem with any of our units, we are focusing on getting those problems fixed, as well as we have bought a few portable air purification units to put in areas if that we feel needs additional ventilation or assistance while we repair a particular HVAC component. Next slide, please. And now I will turn it over to Dr. Wilkins.
Thank you, Dr. Hart. Good evening, everyone. I will cover the purpose of the intent to return form and the feedback from our staff and teachers. First, on the timeline, since this crisis started, we have recognized that we cannot just ask staff to come back to schools without understanding and appreciating the challenges we all face at work and home. We care about our staff and want to know how the staff is managing their work-life balance in this pandemic health situation. We listen and we want to hear from our staff. We also want to hear from our students and our family and of course our great community as we're doing this evening. So we wanted to hear from our staff, all 2,600 ACPS staff. And on November 9th, the superintendent, via 2 live video sessions, informed the entire school division of our goal to hear from them about their work-home experience. This information would help inform how to make staffing plans to support in-school instruction. After the superintendent's informational briefings, we issued the form and tracked to ensure that all 2,600 staff completed their responses. This was a self-reporting format and the staff indicated their concerns of the pandemic health factors, which I'll describe in just a moment. We collected and analyzed those results, and today's briefing will help inform of those findings. We also will follow up this employee form with a family choice form to collect data about our families and students' ability to return to in-person learning. So at the end of this process, we will have both staff and family data to help use and determine the in-person learning model. Next slide, please. So what were the staff results? This slide shows the division-wide or all staff feedback on the pandemic health factors that I referred to. Of the 2,600 staff, approximately 55% reported being able to return in person. The pie chart shows the remaining 45% of total staff who stated they would not be able to return due to the impacts of the public health situation shown on this slide. Reading clockwise, these factors are age 65 or older, 5.2%. Underlying medical conditions, 21%. At risk for complications, including pregnancy or weakened immune system, 10.2%. Caring for a family member with underlying medical conditions, 15.5%. Child care challenges due to COVID-19, 11.5%. Fear and anxiety of the workplace, 31.1%. And the remaining 5.5% chose other. Now let's take a look at our teachers. Next slide, please. We analyzed the data to focus on the classroom teachers to understand their status. Of our 1,290 classroom teachers, 691, or approximately 55%, said they would be able to return to in-person learning and instruction. The light gray portions outline those teaching staff who are able to return. For the elementary schools, 57.5% of teachers said they are able to return at this time. For the middle schools, 54.3% of teachers say that they are able to return at this time. And for the high school, 51.2% of teachers stated that they are able to return at this time. This concludes my portion of the briefing. I will be followed by Dr. Terry Mozingo, Chief of Teaching, Learning, and Leadership. Dr. Mozingo?
Yes, thank you so much, Dr. Wilkins, and good evening, everyone. At this time, I would like to kind of provide you an overview of some instructional learning models that are under consideration within the school system, as well as a little bit more information about one that is currently being implemented, which is the 100% virtual learning model. As you can see on this slide, what we've listed in green, that is those are the components and characteristics of the traditional in-person model. That's the model that we're all so familiar with. So I will not spend any time describing that model this afternoon. In the center, you have the hybrid in-person and virtual instructional model. The advantage of this model is that it provides a sense of safety and connection as students and teachers would be back in the building, particularly on select days. It also provides some in-person relationships because students would have direct access to teachers and students will have direct access to friends. And so we would all be back in the school building on select days. There are, however, six major points that I would like to highlight regarding the hybrid in-person virtual model. We will still be required to maintain the 6 feet social distancing. Obviously, the staff and students will determine the number of days in the school, which will be based upon the survey, the staff's responses, as well as the family survey responses from our families when that is disseminated tomorrow. That will provide us more information about some of the preferences of our families. There's also in the hybrid in-person virtual model a real high commitment to high levels of learning. We still will, students and families and others will still be expected in and out wearing masks, washing their hands, taking temperatures, using common spaces. There are certain requirements and protocols even within this model. At the same time, the virtual in-person model allows for counseling support as well as social and emotional learning opportunities. If you look at the last sort of bookmark on this slide, that is what we are implementing now. Our students are actually currently participating in a 100% virtual model. Students would still have an opportunity if families chose that. That model does provide health risk because it's lower in that students are at home. So at the end of the day, we're currently implementing the 100% virtual learning plus model, but we are considering phasing in the hybrid in-person virtual model. And I'll tell you a little bit more about that model on the next slide. What you see on this slide are several examples of hybrid learning schedules. There's an in-person one for 2 days or 3 days virtual, in-person for 2 weeks or virtual for 2 weeks, or in-person AM or PM. What we actually know is that in Alexandria, the most feasible model, instructional model for us would not be 2 weeks of in-person and 2 weeks of virtual. That's a long period of time that students are not exposed to the curriculum and other expectations. The same with the AM and the PM. It creates a lot of fragmentation and affects the continuity of learning, but it does appear that the in-person 2 days as well as the virtual 3 days could be a more feasible model for our school system. We will engage a lot of teachers and others in the discussion, helping us really determine the advantages of the 2 days in person and the virtual 3 days of learning. What we also know about the hybrid learning is that it provides, it provides opportunities for in-person, in school, in the setting, and in that environment. It also provides many opportunities for regrouping, for reteaching, for setting goals. And most of all, it provides us an opportunity to reduce the academic learning loss. So again, we're in the midst of making some decisions, but what we really believe and feel is that the in-person 2 days of learning and the virtual of 3 days will be a more feasible model for Alexandria City Public Schools. Thank you.
And I want to go over the revised phase reentry plan. As you all know, yesterday we were expecting to transition additional students with special needs who were a part of our self-contained language arts and self-contained mathematics program within Alexandria City Public Schools. Due to the community spread that we are experiencing right now, we made the decision to defer that actual transition of our students with special needs in our citywide program and to defer any transition of our students to January. So this revised phased entry plan or reentry plan is showing the community specifically with dates, because our previous plan just had January and February without specific dates. We wanted to provide the specific dates and the student category groups so that everyone is aware of the exact date that we are planning to transition our students back. So we're going to start in January 19th, where we're going to transition back our students with disabilities in grades K through 2 who are part of the citywide program. And then we're going to also transition on January 16th, we're going to expand that to students with disabilities in grades 3 through 5, as well as our early childhood, special education students, and our students with disabilities who are in K-5, who are receiving self-contained services in either language arts or math or both, and our English learners in grades pre-K through 5. We're going to then expand on February 2nd to our students with disabilities in grades 6 through 12, as well as our English learners in grades 6 through 12. So these are secondary students in special needs and also English learners. And then on February 9th, we're going to expand for all of our remaining pre-K through 5 students who are opting in to in-person learning. And then all of our remaining students through our 12th grade will be expanded on February the 16th. So the expectation is by the end of February that we have transitioned all of our students back, all of our students who are able to return back into our school buildings, participating in our hybrid learning model of 2 days per week of in-person. Now, all of this is contingent upon, 3 key factors. One is staffing, of course. 2 is building capacity, and 3 is the community health metrics that Dr. Herring explained at the beginning of this presentation, and that was the community spread, as well as the positivity rate, and then the internal health metrics or mitigations that we are doing within ACPS. So this is still contingent upon that, but we are anticipating to begin our transition on January the 19th to have our students return back into our school buildings. Next slide. So the final slide before we go into our Q&A is specifically around our family choice form. It is so important for us to hear from our families. We've heard from our staff. We got 100% participation from our staff. So we're able to begin to do our scheduling of our hybrid learning, but we really need this key information from each and every one of you. And specifically what we need to know is what your choice is for your child returning at their designated time, whether it is going to return to a hybrid learning or to a virtual or remain in a virtual setting. This will go out tomorrow, December 2nd, which is Wednesday, December 2nd. There will be an email that will go out to all of our families. There will be text messages as well that's going out to families. You have to complete this form in PowerSchool. And once the form is completed, we will be able to gather that data to help us with our finalization of our hybrid learning scheduling of our students. It's very important for you also to know that, you know, we really want our families to utilize the information that we're sharing. And this will be an overview in the survey, in the form that goes out tomorrow, because we're not calling it a survey, it is an actual form because we need everybody to complete this. It's not optional. But we're going to specifically mention in the correspondence that goes out tomorrow is that we're talking about hybrid learning for minimum 2 days. We are putting all of our safety precautions in place. We have the PPE within our schools. We have cleaning schedules that are in place. We also are taking precautions in regards to transportation and all of those things and the social distancing within our building. And based on that information, we want to make sure that you as a family are making that choice of whether or not you want to send your students into our in-person setting or remain virtual. So we will need that information between December 2nd and December 11th. Now, I'm going to open the floor for some questions. I see that there are several questions that are already coming through. So I want to get right into those so we can use as much time as we have to answer these questions. The first one really relates to ventilation in our schools. So I'm going to ask this to Dr. Hart. The question is, please talk about your plans for measuring and sustaining sufficient ventilation in classrooms. And this is a safety factor for which there is increasing evidence. So can you talk to Dr. Hart some of the measures and steps that we've taken internally?
Yes, so I just want to reiterate that again, since March, the staff, along with our contractor, have been completing preventative maintenance on all of our HVAC systems. Our HVAC systems, really in any facility, are designed to make sure that there is proper airflow, there's proper particulate filtration as well throughout our facilities. That is something that should be an operational order even prior to a pandemic. So our preventative maintenance activities are really what's been critical to making sure that our systems are working. Again, filter changes to include MERV 13 filters, because I believe that's a follow-up question or a question that I saw in the chat as well. So those are being instituted. And so, we are continuing down that vein of just making sure that we are maintaining our preventative maintenance. In terms of upgrades to our HVAC system, we did have some planned upgrades at some of our schools as part of our CIP plan. That was pre-pandemic. We are moving forward with those particular upgrades, but that is not universal to all of our schools. Again, our intent is to make sure that our HVAC systems are operating in the way that they should be operating, and we're doing so through preventative maintenance, through repairs as needed, as well as through upgrades at some of our select schools that were already planned in our CIP program.
And thank you, Dr. Hart. And just a follow-up to that, the most recent science indicates that improved ventilation and circulation are more important than repeatedly cleaning surfaces and even the deep cleans. What infrastructure improvements have been made since March to make sure that our schools are resilient and ready and safe for our staff as well as our students? So can you just elaborate on some of the projects that have been done between March and now?
Sure. In terms of some of the planned projects that were already in the works, there have been some HVAC upgrades at George Washington Middle School. There are also HVAC rooftop unit upgrades that are currently in process for Lyles Crouch. I'm sure there are a few others. I can't recall all of our projects right offhand. But again, the focus has been maintaining our preventative maintenance as well as making sure that we are moving forward with our planned projects in the CIP that relate to HVAC ventilation for those particular schools.
And have we done any air quality assessments in our buildings?
We've done select indoor air quality assessments. Again, it's not universal throughout the division. Indoor air quality really has been based off of work orders or suspected cause for us needing to do indoor air quality assessments. So no, we have not done those universally. We are, do those when we do feel like there is a specific need or issue at a particular school that needs to be addressed.
Thank you. Thank you, Dr. Hart. So this is a question for Dr. Herring. How can we make sure parents, students, and teachers are safe and those who need the vaccine are getting it? This is about vaccinations. How can we make sure that parents, students, and teachers receive these vaccinations or that they're actually getting these vaccinations?
Absolutely. The advisory committee on immunization practices met today, and they are tiering different levels of who should get the vaccine first. I want to tell everybody that there is going to be enough vaccine for everybody to get the vaccine. Not everybody's going to get it on day one. What the federal government is going to do is probably follow the ACIP recommendations that they're tiering 1A, for instance, will be healthcare workers and or residents of long-term care facilities, healthcare workers of hospitals, because they're at greatest risk of getting it, those in the hospitals, and the healthcare workers in the long-term care facilities are presenting a risk, if you will, to the residents of the long-term care facilities. And of course, it's the people who are in the hospitals and the people who are elderly with other underlying conditions that have the highest risk for severe disease. Now, I can tell you that educators are one of the tiers, and I forget if it's level 2 or 3, but that's weeks away before that will be available for them. But I want to repeat, everybody that is wanting to get a vaccine will be able to get one. What that time frame will be, I don't know, because I don't think anybody really knows that for sure. It's going to depend on what looks to be very promising vaccines that are in the market right now or going in front of the FDA for emergency use authorization. And when that's received, they're prepared to start shipping it. But again, the first people are going to be the healthcare workers, then it's going to be fire, EMS, police, so that there's a lot of tiers, but educators are up pretty high in this level of tiering.
Thank you, Dr. Herring. I appreciate that. I do want to ask another question to you, Dr. Herring, that one of our community members asked. They said, are Alexandria private schools required to adhere to the same health department health metrics that ACPS is adhering to? And if not, why is that?
I should tell you that the health department has no regulatory authority over private schools or over Alexandria City Public Schools. What we serve as is a consulting role. There's many people on this call right now that are part of the schools team, if you will, from the health department. One of the things that we did over the summer is we reviewed I think it was close to a dozen different plans. Not all private schools took us up on the offer that we offered to look at all the plans and provide feedback. And we did that for every single school that sent us their plans, including Alexandria City Public Schools, and gave them advice that don't go with 3 feet, go with the 6 feet. And we gave them a lot of reason. And the reason is based off of the data that CDC uses and based off of what we call our close contact criteria, that if you're within 6 feet for more than 15 minutes and that person is ill, then that means you're a close contact. You need to quarantine for the entire quarantine period. So a school or school system really needs to think about what's the impact of that when we're calling on a Wednesday and we're saying, you know, we have to inform you that 8 people, including the teacher, have been identified as close contacts and they need to quarantine. And how do you pivot immediately? It's easier to have people 6 feet apart, masked all the time. And that way, when you have a case, because it's not if you have a case in a school, it's when you have a case in a school, if we're able to ascertain as a health department that people truly maintain their 6 feet distance, then you could actually continue schooling without concern of an outbreak within the school environment.
Thank you, Dr. Herring. There's another question that's about how do we solve the problem with overcrowding and the lack of capacity to social distance? Everything else seems pointless if we don't have the space. And I'll take a stab at that question. And Dr. Hart, if you need to elaborate on this, you can. First and foremost, you know, one of the reasons why when we're looking at a hybrid model, one of the reasons why we can't have students there every day is because of the social distancing component. Having to keep students 6 feet apart and adhere to that doesn't afford us the opportunity to have 100% of our staff and students in a building at any given time. So that's some of the reasons why the hybrid learning approach for us is so important. One of the specific reasons why we believe that 2 days is important too, is because that's 2 days that students are in the building, and then 2 days that they are, or really 3 days, excuse me, that they are virtual on any given week, which will give us the space that we need. We have to keep in mind 100% of our students most likely will not return. I mean, I would be surprised to see that 100% will be able to return. But if we would have some challenges if 100% wanted to return, because we wouldn't have that capacity. But those are the factors that we have to put into place to tackle the social distancing and overcapacity component. Dr. Hart, I don't know if you wanted to elaborate on that.
Really nothing additional to add, but just wanting to note that at some of our schools, we already had a capacity issue prior to the pandemic, which is, being addressed through our capital improvement program. So the pandemic has just exacerbated those issues at certain schools. But I completely concur with the response that you gave, Dr. Hutchins.
Okay, thank you. I see there's another question regarding, and this is for Dr. Herring again, there are a lot of health questions that are here, so I'm glad that you're on this Zoom. According to the city's website, the only people that are affected by COVID in the city are ages 50 to 59 and 70 plus. Is this the case?
No, that's actually not the case. I'm going to call out a website, alexandriava.gov/coronavirus, alexandriava.gov/coronavirus. And on the left of that page, there is COVID-19 data dashboards on the left-hand side. And the second one is the Alexandria demographic dashboard. And when you go there and you click cases, you can actually see it divided out the precise number of cases of the nearly 5,400 cases we've had by different age groups. And when I look at this, we see ages 0 through 9 have had 382, 10 to 19 have had 373. So that's about 750 out of the 5,400 cases in ages 0 through 19. It divides it out by a lot of different demographics as well, but that's the cases, and you can look at this website for the hospitalizations and deaths. So it is affecting all age groups. It's affecting elders in our population more severely, and people with underlying medical conditions more severely when it comes to hospitalizations and unfortunately for fatalities as well.
Thank you for that clarification, Dr. Herring. The next question is, why is fear and anxiety of returning to the workplace a valid reason to be unable to return? And and I'll take a stab at this, and Dr. Wilkins, you can elaborate. I know one thing that was important to us is to make sure that we were talking with our staff around the fact that fear is what we've been hearing was a reason why they felt they could not, return to the building. And I think Dr. Herring could elaborate a little more on this, but fear can lead to other aspects. That fear can actually cause health conditions for you. And what we wanted to know is, if you're fearful, our follow-up to our staff is, well, what are you fearful of? And some of the conversations we've already been having is, there's been some fear about, do we have adequate personal protective equipment? And we're able to share with that staff member that, yes, we do have adequate personal protection equipment to make sure that you're in a safe environment. But what we're trying to do is to be able to mitigate some of those fears, and we're only going to know how to mitigate them by asking that question. And then we still have to do additional follow-ups, which we just started last week, and we're continuing to follow up with our staff members who are saying that they're fearful about this return, so that we can mitigate some of that before we return. Dr. Herring, anything you want to elaborate on in regards to fear and anxiety and how that can have an impact on your work?
Well, it has an impact on one's ability to actually, I think, not just work, but also to learn. And, one of the things that we've done at the health department is really work with people, just like you talked about, Dr. Hutchings, and find out what is the source of the fear and whatnot, and really addressing that and staying with the science. Some people have fear and anxiety because they've actually had a very personal experience. They've had an uncle, they've had a parent, they've had a brother or sister who have passed away. And so when you've had that sort of personal experience, you don't care about the data, you don't care about the science. And somebody, in those cases, people need to work through their grieving process. In different people have different times for that process to play out before they're able to function fully. But Dr. Hutchings, you're absolutely right. When we talk about fear and anxiety, reducing our performance to the point where for some people it can even paralyze them.
And I think a point, and Dr. Wilkins, you can elaborate on this, but I think it's important for us to understand that if a staff member is expressing fear of returning to work in any circumstance, it is our obligation to try to mitigate those fears. People could have fear of being around a colleague, in our schools. It's not necessarily of what the fear is about. Any type of fear that is preventing you from coming to the workplace, it is our responsibility as the employer to inquire and to try to mitigate that fear, because there are staff members, their well-being is just as important to us as our students and their families. So Dr. Wilkins, I don't know if you want to elaborate on that at all from an HR perspective.
Thanks, Dr. Hutchings. I'll just make a brief comment by reinforcing that federal law does entitle our employees to a safe workplace. So we are required to keep the workplace free of known health and safety hazards. Our employees have a right to speak up about hazards without fear of retaliation. And they also have a right to receive the safety and health training in a language that they can understand so that they can work safely at work and be comfortable in all that they do, as Dr. Herring mentioned. However, this does not mean that an employee can completely just refuse to work, right? Under OSHA, or the Occupational Safety and Health Act, the employee must have a genuine and reasonable fear or real danger, not just out of this generalized pandemic, but of the specific workplace conditions. So that is why Dr. Hart and her team have been so diligent about being very detailed on the specific measures that they are taking to provide PPE, to ensure that there's cleaning and other safety supplies so that the workplace is safe for our workers. So federal law does require us to pay attention to this, and our employee safety is a primary objective of all that we do. Thank you.
Thank you, Dr. Wilkins. Another question is, well, Fairfax ordered their teachers back to school and offered them the opportunity to take unpaid leave or leave the system. Why can't ACPS do this? And First and foremost, I think it's important for us to know that we are an employer of employees, and their well-being is so important. We don't want to develop a hostile environment where we say you either do what we say or get out. And that I'm just trying to be as blunt as the question was asked, because what ends up happening, and I think we're seeing this in school divisions across this country, when you take a stance in that or take a position like that, it's a no-win situation. One, when you have large numbers of staff who say, well, in spite of what you said, I'm not returning at all, you've now put the organization as a whole in a very serious bind because you don't have the employees, and then they're also disgruntled. This pandemic at some point will be over, I hope, and they are still going to be employees of our school division. And it's our job, I know it's my job for sure, to make sure that I'm keeping their best interests at heart as well. So their voices matter just as much as our families' voices matter. But I don't know if Dr. Wilkins, you wanted to elaborate anything on the either you come back or you take unpaid leave or you get out of the system.
Thanks, Dr. Hutchins. I would just remind everyone that our approach is to be a more caring and compassionate employer. As I mentioned earlier, over half of our staff have already indicated that they are impacted by that pandemic health situation to such an extent that they are having difficulty being able to come to work, right? And for an employer to simply dismiss the impact of the pandemic health situation on the home life, not just the work life, right? It would be very short-sighted and ill-advised, right? We want to be an employer of choice. And by being an employer of choice, we want to be an employer who understands its workforce, right? And does everything to support its employees for top performance. So from the Alexandria City Public Schools perspective, you're seeing a very deliberate listening and engagement process to understand what exactly is going on with our employees with respect to the pandemic health situation, because we want to keep our employees for the long term, not just through these next few months for the pandemic, but for the long term. And we can do that by listening and supporting our employees in this very challenging and difficult situation. Dr. Hutchins.
Well said, Dr. Wilkins. I just want to reiterate that whole caring piece is so important. We're an educational institution. I think that should be at the top of our list, to be caring and to be professionals and to understand that our staff members, they have families, they have needs, they have stressors as well. And we want to make sure that we're working with them, not against. And we want to continue to be a caring environment for not only our students, but also for our staff. So the next question, and this is for Dr. Mozingo. Why will we be using a hybrid model upon our return? Is it because we are short on staff? If you can foresee a staff shortage, can you begin recruiting extra staff now so that we can return in person 100%? This is really related to the capacity and us trying to adhere to the social distancing. But Dr. Mozingo, you want to answer that? I'm sorry.
Yes, I certainly. Thank you. Thank you so much, Dr. Hutchins. Yes, I would like to answer that from an instructional lens. What I like to kind of restate is that there is an advantage to the hybrid model, and what it does, and it's not as a result of the shortage per se, but it allows us to be able to get groups of children back into the school, as well as staff members back into the school. It allows, as I said earlier, to build those relationships, to create that personalization, to also help us with the reduction of that learning loss. There are many educational reasons for the hybrid model. While we know that there might be some challenges in terms of adjusting, we will be able to the environment and to the new setting and the expectations. We feel like our students will be resilient enough to be able to adjust to the hybrid model, but it does have a lot of educational value for just getting students back into the schools over at least 2 days a week. That's what I see as a paramount value for the hybrid model.
So thank you, Dr. Mazengo. Another question related to students is, so why won't students have the same teacher? Isn't that the biggest factor that affects student learning? And the goal is for us to have students remain with their teachers. That's why we're looking at this hybrid model, and specifically looking at the concurrent teaching model, which we're still trying to solidify right now. Because we want to try to keep students with their teachers. I mean, just think of the fact that November 30th, we were expecting for additional students to return. That did not happen due to the community spread. Then we had some students who were in person, and we had to revert them back to the virtual learning. If we were in a situation where we're swapping to a different in-person, teacher and then going back to virtual and doing that back and forth, I mean, that is so many disruptions for our young people and also for our staff. So our goal is to really try to work this out. Once we get our numbers of how many students are returning, we know how many staff are able to return. But once we determine how many students, to really try to keep our students with the staff member as much as possible. But I can't also say that that's going to happen 100%, because it really just depends on some of these numbers that we're looking at, and unfortunately the numbers just don't evenly kind of add up and to make it 100%. So we just have to see once we get this data back from our families, but we are definitely trying to keep our numbers at 100%. With the student meeting that's hosted tomorrow, is that an opt-in meeting, or will teachers be showing the meeting to students? And I know we have Ms. Burgos, who is our Chief of School and Community Relations, on the Zoom. If you can respond to this question, it's regarding the student meeting that's going to be hosted tomorrow. Is that an opt-in meeting, or will teachers be showing the meeting to the students?
Thank you, Dr. Hutchings. We provided a couple of options. Actually, the students can actually log in on their own. So we have provided a link with a password. We have also provided an option for teachers to be able to show the meeting in class so that the students can participate. And we've also given them an opportunity, a chat box basically, for the teachers to be able to add the questions for the students so they can watch it together. So each of the elementary sessions will be 30 minutes. So it'll be K through 1, 2 to 3, and 4 to 5. And so this will be a great opportunity for the students to be able to converse with, ask you questions, hear from you about the reopening plans, and have their voices heard. So of course, the students don't have to participate. It's not mandatory, but of course, as we've encouraged our students to have voice, we definitely want them to participate. And I know that this was something that you were really trying to champion, for the students to be able to participate and have an opportunity to hear from you. So we've provided several options for students.
Thank you, Ms. Burgos. And let me tell you, I'm really excited about being able to just have some FaceTime with our students. When we were in person prior to the global pandemic, I visited classrooms. I was able to talk with our students. I talked with them in the hallways. So this is an opportunity for me to have some FaceTime with our students as well, and for us to hear from them, because the student voice to me is so important, especially as we are finalizing our transitional plans. We really want to hear what they're thinking. What are some of the concerns and questions that they have, so that we can incorporate some of that information into our final plans. So I really do think that this is a great opportunity to have student voice. The question is, when you ask for preferences, will we have information on what elementary school age children's teachers will be doing? Like our friends in other districts, a lot of our preference is contingent on keeping the same teacher in school. And I mentioned this earlier, that we can't 100% guarantee that every student is going to remain with their teacher, but we are striving to keep that at the forefront. It is so important for students to remain with teachers. So if we're in a situation, if we have to pivot back to virtual learning and vice versa, that we're not having multiple disruptions between the student and the instructor. So we can't guarantee that 100% of our teachers will remain assigned to their students, but that is definitely the top of our priority list, and we're going to try to do that in every situation possible. And then finally, the question, I know we have about 6 minutes remaining, is can parents or teachers change their responses? And if so, how often? And one thing that we do want to prevent us from having is a situation where every week we're asking parents, and 1 week is this number, the next week is a different number, and it keeps fluctuating and going back and forth. And the reason for that is because every time we get these numbers, the plans are solidified, and every time those numbers change, the plans have to be re-solidified. So what that means is that we would continuously be going back and forth and changing these preferences. Now, one thing that we're working towards is this concurrent teaching model that we're finalizing next week. So we'll know for sure if the concurrent teaching model is the model of our choice in regards to how we're going to deliver our instruction. But if the concurrent teaching model is selected for our delivery of instruction, it will afford opportunities for us to, one, stay with the same teacher, to be able to pivot when needed and not have too much of a distraction other than placement of where the students are physically when they're receiving their instruction. But it will be a model that will allow us to have the least amount of disruption. We're still finalizing that with our teachers. We had some teachers from other jurisdictions come into our meeting this past Monday, which was yesterday, and they were able to share with our teachers some of the practices that they're doing, what's working, what's not working, what they would do differently, just so we can get some lessons learned from their work. So more information about that will be forthcoming, but we cannot guarantee that 100% of our students will continue to have the same teacher. We're going to do that as best as possible. So I know that we have 3 minutes remaining. I just want to remind everybody that we got to as many questions as possible during this time, but we are going to answer these questions, and we're going to add them to our FAQ section, up on our district website. And we also will be hosting another session tomorrow at 2 o'clock. So I hope that you all will join us. The final thing is about the actual family choice form. We really need all of our families to complete these forms. It's so important for you all to complete these forms, is to give us the data that we need to finalize our transitional plans, and that is to have the actual hybrid schedules developed for the students who are opting to be in person. We are looking forward to seeing you all tomorrow, and I apologize, tomorrow is 12 o'clock. It's not 2 o'clock. It is 12 o'clock tomorrow is the community session for our families. So hopefully if you have the lunchtime, we wanted to do a lunch. We wanted to do an evening for some families who couldn't get on today at 6. So with that said, I just want to thank you all, one, for your dedication, for all of the extra work that you were doing on behalf of our young people as well in your homes. I get it. I understand that it is a tremendous challenge for many of our families. And I just want you all to know that we are here to support you in every way possible. And we're going to continue working through these challenges, collectively. We know that there are obstacles, but we're resilient. We can overcome this. I think we're so much better together than we are alone. And us getting the advisement that we have been receiving from our health professionals are invaluable, and it is definitely helping us make the right decisions to keep health and safety at the forefront. So with that said, continue to be safe, continue to stay engaged, and please make sure that you're wearing your face coverings when you're out publicly so we can flatten this curve in the city of Alexandria and beyond. Enjoy your evening.
Thank you.